As you might know, atrial fibrillation is considered a worldwide epidemic with currently more than 33.5 million individuals with atrial fibrillation, and these numbers are still rising. So if we look at our clinical practice, this is actually a big challenge for the future. So we're facing an increasing number of complex patients with multiple health problems, and it is expected that these patients will use our healthcare services for a long time. On the other hand, these care systems are increasingly struggling to cope with these patients, so the number of patients, the complexity of the patients, and to adhere to evidence-based guidelines, which leads to fragmentation of care, and that in itself leads to poor coordination of care and poor patient outcomes. So I believe it's time for a new approach in care for patients with atrial fibrillation, and the ESC guidelines, the 2016 guidelines, adopted the integrated AF care approach. And this approach has four major elements, and the first one is that we need to actively involve our patients in their own care process and giving them a central role. I think we heard some more information about that before from the lady from the Heart Foundation in Germany, but I think that is really important. Before patients can take on these roles, however, we have to educate them. So patients have to understand what is atrial fibrillation, what is stroke prevention, how to take anticoagulation, and so on. Having done that, this enables patients to self-manage their own condition, and it opens up possibilities for shared decision-making. So the second element is a multidisciplinary team. So it's not only cardiologists focusing on the management of atrial fibrillation, but having a multidisciplinary team consisting of neurologists, GPs, but also nurses and allied health professions will work together in this multidisciplinary AF care team. The use of technology tools can be very helpful and very powerful in such an approach, and can be used by patients, but also by healthcare professionals. For example, to provide information and education to patients, but it can also help to support clinical decision-making. For example, using checklists, communication tools to monitor the therapy adherence and effectiveness. And finally, there should be a comprehensive approach focusing on the whole spectrum of AF management, so not only treating the arrhythmia, so a choice for rate or rhythm control, but also appropriate prescription of oral anticoagulation, focusing on risk factor management and other interventions like catheter and surgical interventions, and so on. Besides the recommendation that an integrated care approach is recommended in these guidelines, there are three very important recommendations as well. And one is that there should be tailored patient education. It is actually recommended in all phases of AF management to support patients' perceptions of AF and to improve management. So it's really important to check with patients how they think about AF, what their knowledge is, and I will illustrate that in the next slide. But also, patient involvement leads to encouraging them to take on self-management interventions, which I believe is very important and should be part of the management approach. And this also opens up for shared decision-making, as decisions should be made on the preferences and the needs that the patient has, based on, and then therapy based on the best available evidence. And just to illustrate how important it is to look at patients' knowledge and check their perceptions, is this study with more than 900 patients focusing on their knowledge about stroke and related to their perceptions of the seriousness of atrial fibrillation. And I don't know, you can't see the arrow, I think, but maybe with this one. Yeah. So what you see here is the stroke knowledge. So patients with good or moderate knowledge about stroke, there's a majority of half of the patients says, yes, atrial fibrillation is a serious condition, while patients with low or non-knowledge about that think it's somewhat important or not at all important. Moving to the right side, looking at patient preferences to be involved in oral anticoagulation treatment choice, again, patients with good or moderate knowledge, There, the majority of these patients says, yes, I want to be involved in that. It should be a choice that should be made by and me as a patient and the doctor. But again, patients with a low or no knowledge about that, they leave it over to the doctor. So if we divide these patients into patients who are like recent stroke survivors and patients without a stroke, we can see that most AF patients without a recent stroke prefer to be involved in oral anticoagulation decisions in contrast to patients without a recent stroke. And if we look then at the reason for making the choice in the anticoagulant, then stroke prevention, the effectiveness of stroke prevention is most important, but also patients would like to know about the availability of an antidote. So I believe that if we involve our patients in the care, that leads to certain responsibilities, to give them some responsibility to self-manage their condition at home. This leads to involvement again. So I believe if we can do it like that, educate our patients, involve them, give them a role, that will lead to more effective stroke prevention and better outcomes. I now would like to give you an example of integrated care and using IT tools, and this is work from the Netherlands, where we redesigned our cardiology practice and we implemented an integrated chronic care program that was coordinated by nurses. So in this program, there are three major elements. That is, nurses involved in the care for patients with atrial fibrillation, focusing on coordination of care and educating the patients, closely collaborating with a cardiologist. Then all diagnostic and therapeutic procedures are based on evidence-based guidelines, and these guidelines are incorporated in a dedicated software system. And this software system serves as an electronic patient chart, so you can just put information that you get from the patient during consultation. But it also serves as an electronic checklist to really check, did I, as a healthcare professional, stick to the recommendations of the guidelines in this individual patient? Then on the other hand, this software system also serves as a knowledge system. So based on all the information of the patient, based on the guidelines, it can give you a treatment decision. So it can help decision support in the treatment team. And if we look at what we have done, so we have an activated patient actively involved in the care process who is informed. And on the other hand, we have a prepared, proactive practice team that makes use of this dedicated software, and the hypothesis is that that will lead to improved outcomes. Well, looking at adherence, we have like adherence from a patient perspective, but also adherence from a healthcare professional perspective. And the last thing is that we're focusing on here. So to measure adherence to guidelines, we took actually 6 straightforward recommendations, so based on focusing on therapeutic, but also on diagnostic recommendations from the guidelines. And we just measured the adherence rate in the two groups, so the nurse-led integrated care group versus the usual care group. And if you compare the adherence rates, you can see that the adherence is higher in the integrated care group. Putting that in perspective, we found that in 82% of patients receiving integrated care, there was adhered to all these recommendations, versus 38% of patients receiving usual care. So this led to a significant improvement of guideline adherence. And I would like to highlight one other important finding, and that is that there was adhered to 99% to the guidelines and provided appropriate anticoagulation in patients receiving integrated care versus 83% in patients receiving usual care. And this might have led to a reduction of the composite endpoint, which was cardiovascular hospitalization or death, because this led to a 35% relative risk reduction in favor of the integrated care group. So having a look at decision support software to guide therapeutic management. So nowadays there are several gadgets, so to call it, available. And it's really incredible what these systems can do, and I still say within an integrated care approach, because I think we really need to have our patient on board, we need our multidisciplinary team, and we can make use of this software system. So as I said, it can be used as a patient record, it can be used as an electronic checklist to prevent incomplete management, but also as a communication tool between the members of the AF team or between the AF team and the patient. On the other hand, it's very vital to use this as an educational tool, so to really show patients what is atrial fibrillation, what is a stroke, and how does that interfere with each other. And being in Australia now, knowing that patients are really living in remote areas, and it's not so easy to come to a consultation in the clinic in the city, it can be used as a virtual clinic to like Skype in with the patient and really talk to the patient about the situation, and at the same time track their adherence to medication and so on. Looking at a patient level, I think we all know medication boxes with alarms included that give a reminder for the patient to take their medication, but also on the smartphone there are several apps that give a reminder to take medication. Works very well if you talk to the patients. A lot of patients use that, but in a way it's very passive actually, so we don't really have our patients involved in this. And that is one of the reasons that alongside the ESC guidelines, in collaboration with the ME Consortium, we developed two apps, one for the healthcare professional and one for the patients within an integrated AF care approach. So the My AF Patient app is actually developed for patients, and it's hopefully next month or so, it's freely available for our patients. And that focuses on education, so in a simple way to talk about, again, about AF and comorbidities, but also about treatment and self-management. It is possible for patients to record vital parameters in the area that is called My Health, and patients can choose to transfer this to their healthcare professional, and by doing that, it's possible to track information on self-management of these patients. To give you a little bit of an overview how that looks like, here you can see all the sections that we educate our patients on. It's mainly written text that is not too long, not too complicated, to really educate our patients in this field. And on the other hand, we have on the right-hand side, we can ask patients questions on their self-care. For example, how did you take your medication yesterday, to check if they're still on the same track. Then on the other hand, we have the AF Healthcare Professional app, which is actually an integrated treatment manager. And I believe it's a digital version of the pocket version of the guidelines. And I think everybody has a smartphone, so I would really recommend you to download these guidelines and use this app. So it's possible to track the information that patients entered if they refer to the healthcare professional. And it's possible to receive individual treatment recommendations covering all the domains of AF management. Here the overall treatment manager is displayed. So what we can do is fill out for the individual patient the CHATS-VASc score. We can write down here what the choice of NOAC or a vitamin K antagonist is, when it was started, and so on. But also we can have a look at rate control, rhythm control, some questions to guide you into what is the best available therapy for this individual patient. And again, some screenshots how that looks like. So I would really recommend you to have a look at this and play a little bit with that, and perhaps you can use it in your practice. And with this, I would like to conclude by stating that use of IT tools within an integrated care approach is very powerful, but I believe we should do that in a comprehensive, multidisciplinary approach with structured organization of care. I think it's very important to have our patients on board, to educate them, to engage with them, and to empower them to undertake self-management activities in their daily life. And I think the IT tools can have a very important role in communication and adherence, so both from a patient perspective, but also from a healthcare professional perspective, and hopefully it improves outcomes.